With all your heart, you must trust the Lord and not your own judgment. Always let Him lead you, and He will clear the road for you to follow. Proverbs 3:5 to 6. Hi, good morning, and welcome again to my channel. And today we're going to discuss newborn care. A full-term baby is about 37 to 42 weeks old, and when the baby is below 37 weeks old, we call this as a preterm baby. And there are so many characteristics of a newborn. First is about the skin. The skin of the baby usually changes from pinkish to typical red, and about a few days it will adapt and the characteristic of the parents. And we have also rashes. Rashes usually appears, but this rashes is because the baby's skin is adapting in a new environment. But these rashes will just disappear within 2 days. So another characteristic of a child is what we call the cradle cup. So cradle cup is the scaly patch of the skin that develops on the scalp. So brushing your baby's hair daily and washing it frequently every time you bathe him. So this will prevent cradle cup. The next characteristic is we can really observe in a newborn is what we call milia. So milia is the widest pinhead on baby's nose or cheek that you can easily see those tiny white spots on baby's face. Newborn babies have rarely nice round head, perfectly shaped heads, but some babies have large, elongated heads. This is due to the squeezing through the birth canal during labor and delivery. What is caput? Caput is a self swelling of the uh, baby's skin on the skull. So it occurs as the result of the top of the baby's head being pressed against the mom's cervix throughout labor and delivery. And this swelling usually disappears within the first days of life. And we have again another characteristic, we call it molding. Molding refers to the long, narrow, cone-shaped head that results from the passage through a tight birth canal. And the head returns to a normal shape within a few days. Then, in the scalp or the head of the baby, we have what we call a soft spot. It closes with bone when the baby is between 12 and 18 months of age. And reproductive organs of a newborn is swollen, like swollen breast, genitals, and this is present during the first week of life in many female and male babies. They have also swollen genitals, and erections usually are common when the bladder is full and the nerves are normal. And we have again another characteristic, and that is lanogo. Lanogo is a fine downy hair that is sometimes present on the baby's back and shoulders, and it is more common in premature infants. How about facial asymmetry? So your baby's face may appear lopsided, okay? And this is because of the head being held sometimes in the uterus of the mother in a sharply flexed position. And this unevenness of the face by itself, it will disappear within a few weeks. And baby has also crossed eye, and many newborn appears to have crossed eye because the upper eyelids of the newborn often show folds, but this is in the combination of the flat bridge of nose that create an illusion of baby having crossed eye. But the baby's reflection on the baby's pupil, I mean, they are focused on the same object. So let's go to the next part of our topic, which is the care after delivery. So first is you have to provide airway. Providing airway is one of your priority because it provides adequate breathing to a newborn, and you have to clean the nose and mouth of your baby to expel some mucus in the nose of the newborn. And the suctioning of the nose and mouth can help clear the airway. So you are uh, if the baby is delivered at home, so we are just using the rubber bulb to expel those mucus on the nose and in the mouth of your baby. But when the baby is delivered in the hospital or in the lying-in or medical centers, we use a suction machine to expel the mucus from the nose and mouth of our baby. This is to provide adequate breathing. Next is you have to provide warmth and comfort to the newborn baby. A newborn baby is wet from the amniotic fluid and they can easily get cold. So you have to wrap them in a warm blanket to provide warmth and comfort. And the last is bond with parents. So, infancy is a crucial time for brain development. So, babies and their parents are supported during this time to promote attachment. So, there are the three care after delivery. First, to provide airway. Next is provide warmth and comfort. And the third is bond with parents. This is all for today and see you again in my next video. Please subscribe and hit the notification bell so that you will be updated every time I'm uploading a new video. Thank you very much and